Okay, you guys, this picture is São Miguel Island, and it's off of the archipelago of the Azores, Portugal. Okay, São Miguel Island. And it's gorgeous and beautiful, and it would not hurt my feelings if I was there. If you look really closely, you could see a path, a walking path. So, to the right, at the top of the circle part, to the right, you see a white square, rectangle, whatever this is. And I guess that's where you get off when you take the boat there. And there's a walking path. You could walk along the whole, uh, as far as the path goes, I guess. And there's a beach there or a place where people hang out. And it's just the prettiest thing ever. A part in the square, the little arrow thing at the top left, whatever. Okay. All right, so let's talk about the elephant in the room. Let's talk about my upcoming surgery. This is going to sound really weird, but I'm enjoying walking. I'm enjoying having 2 feet. I'm enjoying doing whatever, bouncing around, doing whatever I need to do with both my feet because that's coming to a grinding halt after the surgery. I will be back to square one with no longer. I'll have to be no weight bearing for 6 weeks or longer, depending on how long it takes my foot to heal. For people who do not know, I had a bunionectomy. We talked about screws, putting screws in the bone so that it doesn't resort back to what it was doing before. It doesn't revert back. And he came up with the bright idea of using staples instead. And one of them broke. So the remainder of it has to come out. The prong will stay in the bone forever because to remove it will cause excessive damage to the bone. So it will remain in there forever. He's going to take both staples out. The prong will remain, and then he will put screws in there. He might have to put a plate in there also. Hopefully not. My bones also are not mending. They slice through the bone because they want to realign the big toe and put it in the proper position. And those bones have not mended together. Maybe it's, well, I mean, I just had a CAT scan. Let's see. Had x-rays done. It wasn't mending. Excuse me. I wasn't mending. And so they did a CAT scan because the x-ray can only see to a certain point. And he said there may be healing going on that we can't see. So let's go ahead and do a CAT scan. Well, a CAT scan was not good news. It revealed that it's not mending. So they have a few choices. They can put a cadaver bone in there. They could rough up the bone and that will stimulate it to go, whoa, we've got an issue that we need to fix. Let's mend this. You know, it'll stimulate. There is an external stimulator, and I talked about this. It's not painful, but insurance doesn't want to cover that. They have to battle with insurance. So that's not going to happen. Really awesome. Sarcasm. Anyway. So I will be non-weight bearing for 6 weeks or longer. And I went through pure hell when I first had this surgery back in November. Okay. I tried the iWalk, IWALK, the iWalk, It worked for other people online. It did not work for me at all. I hated it. I tried so hard to make it work and it just would not work for me. I gave up on it. So I went to of course I was using crutches, and I have a knee roller thingy. You bend your leg and you put it on it and you can scoot around. The problem with that is you're using muscles that you never use to zoom yourself around on these wheels, and now you've got pain in those muscles, in addition to the fact that you've got, you are non-weight bearing. So then I did the freedom leg. The freedom leg is okay, but it's heavy and it's awkward to walk with because it could be lighter. That would not hurt my feelings if it was lighter. It suspends your leg so that you can, quotation marks, walk with it. If you look on YouTube and put in freedom walk, or excuse me, freedom leg, you will see what I'm talking about, how it works. There's a thing that you're like a little, I don't want to say hammock thing, but it's a thing that supports your thigh, and then your leg kind of suspends, and you learn how to walk with it. But you have to take it off when you get in the car. You have to put it back on when you get, when you come out of the car, you got to put it back on. I mean, you can't, it's just not ideal. But if you want to walk, that is an option. Crutches are a lot harder now than they ever have been because, again, you're using strength and muscles that you normally don't use, and it's physically exhausting using crutches. It's just not ideal. I do have a walker. If I had to use it, I would. I have a wheelchair. If I have to use it, I will. No weight bearing is just a real challenge. I'm trying to get my brain to accept the fact that this is the new reality, upcoming reality. And I've had a situation where I had surgery scheduled like a month after or whatever the case was. And I got so relaxed, like, okay, it's not for a while. And then I'm like, oh, surgery's next week. You know what I mean? You get relaxed and you just don't even think about the time frame. And then before you know it, it's here. And you're going, oh, you know. And I do, extra cleaning and around the area that I'm gonna be in and make sure it's really clean. Get laundry done and put laundry away and, just do all this extra stuff. It's almost like when a woman's having a baby and she does nesting, all this cleaning, 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 because you're gonna be out of commission for a while. So you just everything that you need to do, you do ahead of time. For people who have never had surgery before, I've had a lot, okay? I've had a multitude of surgeries, so I know how this works very well. I'm well-versed on how this goes. One of the worst surgeries, or prior surgery, what happened was everybody's gonna dance to the doctor's tune. So if the surgeon says, "Get the patient in the OR," and I'll be there as soon as I'm able to, or whatever the case is. So one particular surgery, and I start freaking out before every surgery. It happens all the time. That's just what I do. You know it's inevitable that they're gonna inflict pain on you, and then my blood pressure goes really high. This is a every single time event for me. Never fails. And medicines are amazing because it doesn't matter how scared you are, it makes no difference. Once they put some calming meds in your IV, You don't care what they do. Medicines are the bomb.com. They are the best thing since sliced bread. It kicks your fear, karate kicks it, and you're just like whatever. However, that one particular surgery, they put me in the OR and I was in there for a long time. So I had plenty of time for my blood pressure to keep skyrocketing. The nurse is starting to panic. She's trying to have me talk about everything under the sun. He's not coming in the OR. He's not coming. He still hasn't come in the OR. I'm seeing the instruments on the table. You see the light above your head. You know this is inevitable. And he's taking his sweet time about getting in there. They put me in their OR too early that one particular time, and I was freaking the hell out. They had to give me tons and tons and tons of medicine to the point where my friend was there afterwards and I couldn't even they oh my god. They gave me so many meds I had to have help getting in the wheelchair. And because I was in the OR for too long and y'all gave me too much time to freak out. So what happens? I freaked out and she's desperate to talk to me about all these different things and I know what you're trying to do and that just I know you're trying to distract me so that freaks me out even more. Okay. It's just it's just not fun. It's just not fun. Don't ever put me in the OR 20 minutes before the procedure. Just don't. Just don't. It's just not good. You're giving me way too much time to freak out. So they put so much medicine, they gave me so much medicine to force my, BP to calm down, and then they had to help me. I could barely stand, I could barely walk, and they helped me into the wheelchair, and then that might have been when I had the metal removed from my leg a year after I broke my leg. Um, I heard the nurse say to my friend, "Don't let her do nothing, make sure she lays down as soon as she gets home." Because she's looking at how jacked up I am and she's like, "Oh, wow, yeah, they had to give me enough medicine to knock down a damn horse because y'all gave me like I said, you gave me too much time to freak out, and that wasn't good." Uh, so what to expect? They'll tell you, stop eating, um, by midnight the day before. They will tell you what meds you can take, what meds you can't take, okay? And it all depends on what the surgeon tells the nurse because some surgeons will say you can take all your meds and some surgeons will say no, don't take any of your meds. Sometimes, especially if you're staying the night, they don't want you to take any of your meds. Um, they will dispense those meds to you themselves. They don't want you taking your own medication. They will give you whatever you have to have if you're gonna be, spending the night there. The surgery is gonna be an in and out, probably you know, like the original surgery was. And they already did the pre-survey thing. I don't mean survey. It's like a questionnaire, you know, asking you if you have any, adverse reactions to anesthesia, confirming the medications that you're on. Are you allergic to anything? It's just your typical questions that they have to ask you prior to surgery. They may do another questionnaire the day before and tell me, don't stop taking your meds by midnight or stop eating and drinking by midnight. Now, if you don't listen and you decide, it's 1 o'clock in the morning, I'm gonna have a bagel. I know I have surgery tomorrow, but I want a bagel real bad. They may not do your surgery the next day. So I strongly suggest that if they tell you do not eat anything or drink anything past midnight, that you do that. Otherwise, they will probably cancel your surgery. And what else? They generally don't tell you here at this hospital in where I'm going. They don't tell you until the day before what time your medicine what time your surgery is going to be because of trauma cases may come in. And if there's nothing that is a triage situation, then you'll go ahead and have your surgery at the scheduled time. But if an emergency comes in, they have to tend to that first. Or if a surgery prior runs late, then you will be pushed back into a later time. But they always keep you informed. They don't surprise you with, oh yeah, it's now 12 o'clock noon and you were supposed to have your surgery at 8. My bad, we were busy, right? They always keep you on top of what's going on. And they even tell you, okay, we're going to come back in a few minutes and we're get ready to take you to the OR. So they keep you well informed. You talk to everybody prior. The day of, they set you up with your, well, first of all, the night before, they have you clean with these special antiseptic cleaners on your body. Do not use them on your private area because that is not going to feel good. Those are some super strong medicines, and you cannot, you just cannot put that on your personal area, and they will tell you that. You can use it everywhere else on your body. And then you're going to do it again the morning when you get to the hospital and you get checked in. They're going to have you remove your clothes, remove your underwear. Here's the thing, okay? Here's the thing. And I found out why, and I'm going to tell you what, how this works. The nurse may tell you before you go to the OR, the nurse may tell you you can keep your underwear on. Wrong. And I found out why you have to be nudie underneath your hospital gown. The nurse finally told me after all these surgeries. I said, they tell you to keep your underwears on, but they don't want you to keep your underwears on. The OR does not want you to have your underwears on. And this is what she told me. And this is the first time I had heard it. She said, let's see, how did she word that? Something about when you're put under, you always leak a little bit or something, and they don't want you to do that on your underwear. So something along those lines. I can't remember exactly, but the nurse will tell you you can keep take everything off except your underwear. No, you cannot. You need to take off everything, and that's just the way it has to be, because when you go to the OR, they do not want surprises. They will allow you to, the hospital will give you socks to wear. They don't want you to wear yours. They want to give you the socks that the hospital has, and you could keep those on. Obviously, if whichever foot if you're having a foot surgery, they'll obviously take that sock off. Let's see what else. If you're scared about going under, let me tell you something, and I'm going to sound like a real weirdo, but you guys know I'm weird, so it's all good. Going under is the best sleep you will ever have in your life. I'm going to try to describe it. You go under fast, within seconds, okay? Usually with, probably almost always with propofol. In the medical community, I worked in the medical field, we used to call it milk of amnesia. Mention that to your nurse if you go to the hospital, and they'll start laughing because they'll be like, oh yeah, well versed on that, milk of amnesia. It's a white milky substance. It's called propofol. When they put that in your IV, you're freaking done. You can actually watch people on YouTube go under. Yes, you can actually watch them go under after they put propofol. I call it propy. After they put propy in your IV, some people can actually resist it, and for minutes. I can't. In seconds, I'm done. Okay. But I've seen a guy. He said, y'all not going to put me under? They said, "Oh, yeah, you're going under." He said, "No, I'm not. Watch, I can resist it." And the anesthesiologist started laughing. He said, "Oh, you think so? Yeah, you'll see. We'll see." And he was able to hold on for a while, and then I'm like, "Oh, he's gone." And then he's like, "Ha, I'm back. I didn't go yet." Ha. And I'm thinking to myself, "How in the hell can he resist it that long? I can't do that in seconds of history." History. You don't remember. So this is what it's like when you're under. You don't hear anything. You don't dream. You don't have any thoughts in your head at all. You are basically out, way out. So this is the way I watched a diagram of how this works. So you've got, let's just imagine your brain, and you've got these lines that connect each part. Let's just pretend there's lines that connect all the communication centers in your brain. Well, when you get put under, those lines disappear. And these are not real lines, okay? I'm just using this for what I saw in a video, which helps describe it. All of those communications are interrupted. So there is no thoughts, there's no dreams, there's no anything. It's like a dimmer switch for your brain. I personally love it because I have chronic insomnia. So when I take something that knocks me on my butt and I don't have a choice, hallelujah. I absolutely love propofol. It's my friend. I love it. I absolutely love it. You can't, like I said, you have no thoughts. It's you know, all the communications in your brain have been temporarily suspended. And it gradually comes back to you when you come back around. Some people, unfortunately, have had where they were waking up in the middle of surgery and they heard the doctors talking, and the anesthesiologist who monitors you through the entire process from start to finish of your surgery. They will notice that if your blood pressure increases, that means there's a strong possibility you're coming back around, and they'll have to knock you out with some more medicine. And there have been times where the patient has told the doctor, "I heard you guys talking." And the doctor said, "No, you didn't." And the patient said, yes, I did, because you said something to the nurse and the nurse started laughing. You both started laughing." And then the doctor's going, uh, uh, they're stunned because that's exactly what happened. So that's proof that the patient heard you. Now, before you freak out about that, do not. It's never happened to me ever. Never. I never woke up, thankfully. Thankfully, I never woke up during a procedure or anything like that. When I was out, I was out. Way out. I'm talking super way out. And because of propofol knocking you out, when you wake up, it feels like you may not remember, you may not know you had surgery because your brain has no clue what's going on because of the propofol. When you give a medicine a nickname, you got problems. uh, yeah. So some people woke up from surgery and said they didn't realize they had their surgery. So they're like, "Am I going to have my surgery today?" "Yeah, you've already had it. You're in the recovery room." "I am." I've never had that problem. Um, I do remember when I had the tumor removed from my spine, they put me in a darkened room afterwards, a darkened recovery room, and I thought I was in a closet. That's the weirdest feeling I ever had after surgery. I remember my face was frowned. I'm scowling and I'm going, "Why did they put me in a closet?" Because the room was dark. I was convinced they stuck me in a closet. Uh, But the surgery goes it seems like it only lasted for 5 minutes when in reality, it obviously did not, but your brain is not here on the planet anymore, so you don't really have any concept of time. So it seems like you went to sleep and your surgery happened and you woke up. It's real weird. You're usually not in pain after surgery because they give you medicine, during surgery, and they give you medicine usually before you wake up or after you wake up, they will give you something. They give you more than enough medicine so you're not waking up in agony. Okay, so you don't have to worry about any of that. I strongly advise, this is the strongest advice I could give you pertaining to this particular topic. Make sure that you stay on top of your pain meds. If you're supposed to take it every 4 hours, put an alarm on your phone. Every 4 hours, put the alarm on, because if you're going to want to sleep a lot probably. And if you go past that 4-hour period, oh honey, oh baby, you'll take your medicine when you remember to take it, but the pain has already started. You don't want to do this. Trust me, you don't. All right. Take it on take it on time. Set the alarm on your phone every 4 hours. You have to be meticulous about that because I've made that mistake before. I slept through a long time ago. I don't do it anymore. Okay. But I've accidentally slept through when I was supposed to take my next dose and I didn't. And I was in hell until that medicine kicked back in. So I don't do that anymore. Trust me, I don't. What else? Mm. I had the last surgery in November. I had a week's worth of medicine. This upcoming surgery, I'll have a week's worth of oxycodone or whatever it is that they give me. I can't remember. And they only give you a week's worth. When you wake up the next day and you took your last medicine the day before, uh, especially with a foot surgery, the pain is, there's no words. There's no words. It feels like, for me, it felt like my foot was hit with 100 hot hammers at the same time. It was pretty awful. My toes were swollen. They looked like little sausages. They were black and blue. Even the toes that weren't affected by the surgery, they got angry that part of the foot was messed with and they start acting out too. Uh, yeah, I've been through this before, so I know what to expect. And it's just, I wanted to schedule it and get it done. Is basically what I wanted to do. It has to be done because like I said, there's a crack in that particular staple, and obviously that's not over time. That's not going to be stable because it's not stable now. Um, he won't know until he actually gets inside there if there's any healing to the bone at all. He doesn't know what he's going to have to do to encourage healing. He doesn't know if he's going to rough up that bone to kind of stimulate it so it knows to go, "Uh-oh, let me start mending," or if he has to put a cadaver bone in there to fill the gap in because my body's not doing what it's supposed to do between now and surgery day. He might see that it's progressing in the right direction and there doesn't have to be any intervention to encourage the bones to mend because they're doing it on their own, which I hope, and I will literally pray that God touches my foot and tells my bones, "Hey, come on now, let's get it together." I've never had this problem before where bones needed to mend. They always did. I don't know what's going on. So, if you're scared before surgery, they've given me Versed before. Versed makes you forget everything and you don't care about nothing. because I was freaking the nurse out because, again, my blood pressure goes extremely high. I'm freaking out, spazzing out. And the more they scold and say, "You have got to calm down." I'm like, "I'm trying to calm down." And you're stressed out that you're not calm, so your blood pressure goes higher. And it's just one of those things. So they will give you medicine. And like I said, the medicine will calm you down. You do not have a choice. It will knock you on your backside and you will calm down. You absolutely will. Uh, yeah. There was another time I was in the OR and they basically lied to me. Listen, I worked in the medical field. Y'all not slick, okay? Y'all not slick. They gave me a mask to put over my face and they said it was oxygen. It wasn't oxygen. I could smell the medicine. And it's I think it's called sevoflurane. Usually it's I think I'm pronouncing that correctly, sevoflurane. And I could smell the freaking medicine. Don't tell me it's oxygen. Anyway, I basically told them I feel like I can't breathe with that mask on because of the heavy dose of medicine that was in it. I just couldn't breathe. And so they just put me out a different way. But yeah, here, this is oxygen, but I could smell the strong smell of medication. Really? Really? Don't try to trick me. That doesn't work too well. Okay. Anyway, if you have any questions about surgery, like I said, medicine will calm you down eventually. Even if you're scared, you're nervous, that's normal. Um, it is normal. And if your BP goes bananas, they will give you something, or they get worried, they will give you something that your fear just disappears. It just evaporates. But if you have any questions, let me know. And you guys take care. Much love. Bye.